Athlete Health is a directorate set up this cycle to support all aspects of an athlete's physical and mental health. We do that focusing predominantly on the priority injury problems and illness problems which have the greatest impact on availability for athlete preparation and performance. Yeah, so the purpose of the Athlete Health team is to work with the world-class programs, to work across EIS disciplines, to both identify the injury and illness problems which are having the greatest impact on availability, but also to work with those staff and athletes to tackle those problems with initiative aimed at preventing and managing well priority injury problems both within sports but also those problems which go across the high performance system. PDMS is designed to robustly record medical and physiotherapy records so that they can be communicated accurately and kept medico-legally safe. But also the job of that system is to provide us with insight into the most important health problems that are impacting our athlete population. So we have a team whose job it is to develop and run that system, but they do that very much in consultation with other staff across the system at UK Sport, at EIS, and the practitioners within the sports so that it becomes bespoke for the elite athlete population. Within Female Athlete Health, we're working closely with the EIS Physiology team in particular in part of the Smart Her initiative, which is running a series of roadshows around the country last year aimed at education for staff and coaching staff around female athlete preparation and health problems and managing them as best as possible. And this year targeting athletes directly who are currently attending these roadshows around the country. Further work, innovative work that's going on in conjunction with physiology, EIS Physiology, the nutrition team, the EIS doctors and performance innovation is work, for example, around being able to measure accurately female hormones and their impact on both health and performance issues. Last year, a mental health steering group was formed by UK Sport. They developed a very strong strategy for mental health for the high performance system. The job of the EIS mental health team is to ensure delivery of that strategy. That's done through a head of mental health and a mental health manager. We work very closely with other professions very interested in mental health, such as our sports doctors, performance lifestyle advisors, psychology team. And they also have an expert panel that they can call on for advice, and the system can access of clinical psychologists and sports psychiatrists who add to that team. And that team's job is to try and ensure that everyone in the high performance system has the best opportunity to have positive mental health, but also to have really good care pathways and networks of practitioners and advice available for when people do have mental health problems. Probably the biggest health burden on the system through this cycle, and the product is a big project with Royal Brompton Hospital, one of the world's leading heart and lung hospitals, the Institute of Sports Exercise Health at University College London and Imperial College, to identify those athletes who are really susceptible to losing training and competition time due to respiratory illnesses such as asthma, allergies, sinus problems and repeated infections in the upper airways. And so there's a program in place where we identify those athletes, around 150 to 250 in the system, who have a really thorough profiling of their respiratory health with a respiratory physiologist and a respiratory consultant. And then they work out a program with the doctors in the sport to optimise their management, hopefully stop them getting sick so often, but when they do get sick, so they're back in training, full training as soon as possible.